on next steps.
Thank you very much. I think it gives us a lot of ideas to think about, and of course we will consider to hand in this abstract. I think that would be a great opportunity for us. There's still some room for questions for both Adele and you. Adele, I think you already had a question yourself to Marleen. Maybe you can.
Yeah. Thank you for that great perspective. That was really nice to hear. You mentioned your own research on mapping civil society groups. I was wondering if you could tell a little bit about any related to diet or food security or access.
Yeah, so of course there's a lot been going on in the past few years about transition in food production, and this program that I'm evaluating in the Netherlands, and we did also some international comparison, is also looking into how we can promote public health, not just within the areas that have traditionally been working on food production, but also think about these same issues in the healthcare setting, in employers thinking about fertility programs for their employees and having food in their canteens, things like that. So having a much broader perspective involved. And my focus is particularly on the governance, the coordination of the interactions between these very different domains, because they really speak different languages. And as motivated as they are sometimes, it's still extremely difficult sometimes to get to a common area and a common language before you really can take a joint action, collective action. So we really focus on how to organize the process under which they explore the common areas, the commonalities, the common ambitions, the areas where they are fundamentally interdependent on each other. And once that's clear and they've committed, they've acknowledged this interdependency, then there's really a good basic layer where they can really start engaging with collective actions to start changing the food production system or the food provision in their organizations.
It also reminds me a bit of the whole project. We had to learn to speak each other's language. We have a lot of different people in the consortium, but I think in the end we managed quite well. I would like to give the floor also to Tassos. Maybe you can reflect a little bit on the points that were raised by Marleen, because I think there were some meetings last week with the municipalities, I think. I don't know whether politicians were involved.
Yeah, we indeed had the opportunity in the last weeks to interact with the personnel of municipalities in the area of Thessaloniki, not necessarily politicians. They were also staff from the various levels of various departments that are including the technical departments of the municipalities, the public health departments, etc. I would say that it was encouraging. That the message that we received was encouraging. First of all, it seems that they appreciate the ability of such a system, not necessarily BigO, but in general a system that can capture the behavior in relation to the conditions of the environment. For me, that was not an obvious finding. So in both municipalities that were described in Professor Hasapido's presentation, we had good reactions in that terms. we had even requests for more detailed monitoring of specific actions of the citizens. For example, the use of certain resources that is not now part of BigO, but using the same tools, we can capture also this kind of information. So it seems that at least this mid-layer of municipality staff is willing to explore the capabilities of the project. We don't have a real interaction with the political personnel, I mean the mayor or the leaders of the opposition. I still have questions regarding this, and I fully agree with you that the approach that they usually have is not triggered mainly by the evidence. It is in some cases triggered by the second thoughts about the future elections, etc. But yeah, this is the point that we are right now. I have also one question for you that maybe you are the right person to at least contribute. One of the main issues that we face is the sustainability of the data collection. For the duration of the project, the data collection was funded by the Commission. It was part of the funding that we had, and we had the resources for doing this. What is your opinion regarding the future of this kind of operation? Is BigO or similar systems, in order to produce evidence, they need to have a consistent and longitudinal collection of data. Who is going to fund this before we are able to deliver evidence? It's a chicken egg problem, in my opinion, but maybe you have experience on similar. You can enlighten us on this.
Well, I'm not sure if I can enlighten you, but I can certainly just try to think along. I think there's several options there. I mean, one option could be to turn it into a private enterprise, so to say. Another option would be to seek already existing structures and to make sure that it's linked up to, for instance, the data registrations that already take place in many European countries in public health monitoring systems. There's also, well, all kinds of systems are being developed, of course, based on geographical information that I think it might very well be part of. So there are already existing infrastructures. Another option maybe might be, because I know that in the Commission they are of course very well aware that it doesn't stop at developing the technical system. It requires a longer range of development to actually make it sustainable. So I'm not sure what options you have to apply for a continuation of the project, at least with a focus to get it embedded somewhere. But I can imagine there would be opportunities.
Yeah, maybe I get in the chat that Bent wants to react to this.
Yeah, I just want to mention that I mean, these amazing sets of data, this is a perfect example of what needs to be made available, let's say, after the project ends. And I just want to mention the FNHRI, the Food, Nutrition and Health Research Infrastructure that is currently being applied for. I think that would be a perfect example of how data could have an afterlife after the project. So just an idea. how to make data a little more longer lasting.
Yeah, thank you for your contribution. I think
Thank you.
that's indeed. Yanis, you want to add something? Raise your hand.
Yes, I mostly want to ask something. It is a little bit of a continuation, and it's a little bit more. Maybe you don't know. I'm gonna ask you to guess. I think we found you here, and now we're asking all our questions. But I think this is a little bit more modern problem in a sense. How do you think, because of now with COVID, and you saw the data that we have, because of COVID, a lot of these population monitoring systems came into focus suddenly. But on the other hand, and this is anecdotal, based on my understanding and my personal experience, a lot of people a lot of the citizens themselves, maybe especially as COVID elongates the problems, we are still not out of the tunnel, one can say. People get maybe a little bit not willing to, it gets a little bit too much of public information and too many systems tracking visits to hospitals and beds and deaths and all this. Do you think going forward, after hopefully we go through the crisis as Europe, I mean, and globally, is this going to kind of enhance the potential of systems like that? Or it's going to be to kind of maybe hold it back a little bit? I don't have an answer. I'm just asking your opinion. I don't know.
So your question is if the pandemic is under control?
No, absolutely
sorry.
No. If the pandemic and all this that we experience, that this type of public monitoring systems are in focus, if this is going to help such initiatives going forward, or if it's going to create apprehension, fear, or maybe not willingness after we are done with the pandemic, we forget about public monitoring now. We give enough money for COVID or something like that.
I think we really have a change going on here that cannot be ignored. There's a new generation that is experiencing a crisis that my generation has never experienced. So I'm sure the new generation entering authoritative jobs in a number of years will have a very different perspective on priorities than we have. So I do think that the focus on prevention and public health and how it is interlinked with our environment has been put front stage very prominently. And I think it cannot be ignored anymore. We've seen it in the elections also in the Netherlands last week. Yeah. It has been much more a priority in the political campaigns. And the ministry is preparing legal acts and policies I had never imagined in the past 20 years. So I really think things will be changing, but of course, there are also other dynamics going on because we will also have a financial economic crisis as a result of this, and how these interests are going to be balanced. Who knows? We still have a liberal government after the elections. So in that sense, not much has changed.
Yeah, thanks. I don't, we'll see, I guess.
Yeah. But I guess there's a lot of attention now at this moment, both to this whole big data and data stuff, as well as childhood obesity and issues during this whole COVID situation. And so this makes this project very, very relevant at this moment, I would say. But I'm not sure how how that will help us in the future, but I'm happy that at least a lot of people are attending today. Are there any more questions for our speakers of today? Because we are also running out of time. I do not see